back. This is Boomer Life on CL 650.
It's gonna be a long night. It's gonna be all right. On the night shift.
Yeah, we're talking about trying to get a good night's sleep all night long, and this is Boomer Life. I'm Zach Spencer, and today we're joined by the SnoreDentist, and the website is SnoreDentist.ca. Dr. Charnel Muir joins us in studio, and we're focusing on oral appliances to help alleviate snoring and sleep apnea. So you have different devices, one for snoring and one for apnea, or both?
Right. So there's two types of appliances. The type of appliance that's used for sleep apnea can be used for snoring as well. So it's a universal appliance. They have to meet criteria. If a patient comes in and they have what we call primary snoring, which is they only snore and they don't have sleep apnea, we can use less durable and less costly appliances because it's technically not classified as a medical device or a medical condition.
Okay, now how do you determine that? How do you get somebody into your clinic and then find out where they are on that spectrum, if they're snoring or sleep apnea? So what do you do?
What do we do? Well, the first we do is we sit down and talk with them. We find out what the symptoms are at home. Then we send them home with a home sleep monitor. And it's a little monitor you wear at home for one night. And it records your snoring and your oxygen and your breathing and your sleep position. And it records all these things. You drop it off with us the next day. We download it.
And how would you sleep with this? You wear it on your mouth?
No, the one we use, it has an effort belt that goes around your chest. Mm-hmm. It has a finger probe that measures your oxygen. Mm-hmm. And it has a small little nasal cannula that measures airflow. Mm. So it's really simple to wear. Very easy to wear. Just wear it through the night, drop it off the next day. We download the data, we look at the data. The data is then what's called scored and interpreted. So all of my patients must be diagnosed by a board-certified sleep physician.
Okay.
I am not licensed or qualified to diagnose patients. I just treat them.
Well, Dr. Fleetham, who was on another show, he said back in the day, he used to have to listen to recordings of snoring. That was his job, to sit there and listen to snoring. So this is helping alleviate that part.
So the majority of patients in British Columbia are diagnosed with home sleep studies versus going to UBC and doing the in-hospital sleep lab study.
Right. They're probably more comfortable at home.
We tend to think that we get more patient access to care that way, which is true, but you won't get nearly the detail that you get in the hospital setting. The hospital setting has 12 different leads that it measures, including brain waves. So the limit of the home sleep monitor is it really doesn't know you're sleeping, but it'll measure everything that we're looking at for breathing.
Do you think it's a good baseline to start with?
It's a great baseline, and it's very diagnostic. For the vast majority of patients, it's all that's needed. Yeah.
Okay, now someone's listening to this, they're snoring, or their spouse is snoring, or their partner, and they think this is great, this is for me, and they probably, their partner may be resistant to wearing one of those CPAP machines, or they've tried that, and as you mentioned, 50% give it up after a year. And they're thinking about this and going to the snore doctor. Price. Everybody has a question like, how much does this cost, right? Because you're telling me that this is a custom-made device for your mouth. So what's the cost typically for an average patient?
So typically, it's strange, I know this is a rather broad range, but it can be anywhere from $500 to $3,000.
Wow.
But depending on where you are on that continuum, the vast majority can be covered by extended healthcare benefits. So none of the treatment for snoring or sleep apnea is covered under MSP, whether it's an oral appliance or a CPAP. But they are covered under your workplace extended health benefit plans, or if you have a private plan that you've purchased yourself. So for patients that are primary snorers, and one of the things that I really want to say as well is that no patient should ever be treated for just snoring unless they've already done a home sleep study or an in-lab sleep study and been shown to just snore. Because if we treat patients for just snoring and they have sleep apnea, we could be doing a lot more harm than good by making them a silent person slowly dying in their sleep.
Oh.
So it's really important that patients get properly diagnosed before they're treated.
So that diagnostic home kit, what does that typically cost to do that?
Yeah, there's no charge for that.
Really?
No, there's no charge for that. The patients come in for their consultation. They take one of my monitors home. I have the results all scored and interpreted by a sleep physician. Then we report those results to the patient and their physician. And if therapy is appropriate, we proceed from there. We only ever do therapy when the patients are very clear if there's any cost to them, because we always pre-authorize with their extended health benefits before we even start.
Right. Now, so say you're going to be moving forward. What's the next step? Like, walk me through the process of getting a device fitted and how long it takes and how many visits and that sort of stuff.
Right. Well, there's two main visits. Once we have you diagnosed and we know what we're going to do, we need you in for a records appointment, and then 3 weeks later, up to 4 weeks later, depending on, whether we're going to hit a week of holidays or a long weekend. So 3 to 4 weeks later, we have your device in, we deliver it to you, we show you how to wear it, we send you home, and then we follow up with you monthly after that. So there's the two big visits, which are about 45 minutes long, are the records, measurements, impressions, and bite registration all in one. Then it's custom made, and then we have the delivery appointment.
Do you ever do the sleep monitor test again?
Oh, we almost always do. So if a patient is snoring, we don't have to do the sleep monitor again, because usually they'll have a bed partner telling them how well they're doing or not. And we teach them how to adjust it at home if they're still snoring. If patients have apnea, they should be tested afterwards to objectively make sure that the condition's looked after. Because some sleep apnea is very silent. You'll never know it. If we control the snoring, but you're still having apnea, you wouldn't necessarily know.
Now, you mentioned earlier that you're adjusting the lower jaw forward, maybe 5 millimeters, a little bit more. Once you get the device, is there adjustment in there, or is it or not?
Yeah, so they're all made. That's part of that process, is that the appliances that we use for snoring and sleep apnea have to have a certain range of motion. They have to be able to adjust forward, either at the beginning to control the initial condition, or over time as it worsens, so that appliance that they're going to wear for, say, 3 to 5 years can adjust with them as they age and worsen.
We're speaking with the SnoreDentist, www.snoredentist.ca, Dr. Charnel Muir. So am I hearing this right? It's about 5 years these things will last?
Yeah, we have the ones that we use for sleep apnea have a warranty durability of a minimum of 3 years. But most patients wear them up to 5 years, some even longer. If they have benefit coverage, most benefit plans will replace them every 5 years. And what we ask is that during the lifespan of that appliance, when that patient's wearing it, we ask their general dentist to fit any dental work into the appliance, because it's most important that they breathe. And yes, their teeth are important too. And we want their dental work to fit into the appliance that's keeping them alive.
Okay. So you're saying that it can last up to 5 years. When you get a new one, do you have to go through the whole thing again? So what I'm getting at is, can the cost be less for a refill?
That's right. So refills are less costly. So basically, we're not going through all of the initial measurements and records and all of that again, but we will take new impressions, and we'll generally take the bite registration where they currently are, and then allowing it to go forward from there over time if need be. Yeah.
So are you saying that the lower jaw will slowly move a little bit as you go along?
No, but they'll know that position. I'll say to them, okay, if you posture your jaw to where your appliance is holding you now, can you replicate that without your appliance in?
And most people can?
Most people can. And if they can't, we just have them put their appliance in. We take that measurement, and then we remove the appliance, and then we take the bite at that position.
It's interesting because I've heard of over-the-counter or over the internet snoring devices that you can put in your mouth, and I always thought, that can't be comfortable. I look at my kids' mouth guards they wear for football and
or
soccer,
hockey,
and all that sort of stuff. So, what do you have to say about these self-remedy versions?
Right, and we in practice call them boil and bites because they're most often just put in boiling water. Then you take them out, you let them cool a little bit, and then you put them between your teeth and you bite as hard as you can. They have an arbitrary position in them. The patients often don't know what position might be best to hold their jaw forward. They're usually really bulky, and they're quite uncomfortable to wear because of that. But one of the highest rates of failure with them is retention. They just don't stay in. Patients spit them out in the night, or they only stay in place for a couple of weeks.
So can you describe to me how big your prescribed versions are? How far along the bottom teeth do they go and the top teeth? Is it halfway? How does it work? The back two molars?
No, we'll cover all of the teeth to some degree.
Oh, so it's a full top and bottom, yeah.
And there's a couple of reasons for that. One is we want them to have a retainer type of feel as well, in the fact that I wouldn't want to cover just some teeth and then have gaps develop between other teeth because they weren't being held in or something like that. So we
want all of the teeth to be doing all of the work.
That's right. So all of that appliance is going to cover the teeth to the back, ideally, yes. But the material itself is often, like we have one appliance that the material is less than a millimeter thick. It's extremely thin. So it's not bulky in your mouth at all. And although some of them do have a flexible kind of liner in it, it doesn't deform with hot water like a boil and bite appliance. So it maintains its fit and integrity for years.
And you're saying about 5 years is the lifespan?
Usually, yes.
Well, that's good to know. So what do you have to say to somebody who's listening right now who has a snorer in their life or maybe suffering from sleep apnea? What do you have to say? What should they do?
You know what? The number one thing they should do is come in and talk to me. I want to see if I can help them in any way. If they're not wearing a CPAP and they have sleep apnea, they need some treatment. Sleep apnea is a dangerous condition to leave untreated. If they're snoring and it's bothering people at home, do them the favor and come in and talk to me. But also do yourself a favor. It's not a good thing to be doing. Snoring is not normal. It's common, but that doesn't make it normal.
So I'm abnormal. I knew it.
Now, I saved that till right to the end, just in case you felt insulted.
Well, I appreciate it. I'm not going to tell my wife. No, I'm not going to talk about this with my wife because, she's the one who suffers through the snoring.
That's right.
I might not be getting a great night's sleep. I have no idea. But I'm going to go for a nap after this. There's the telltale. All right. Thank you very much. The SnoreDentist, Dr. Charnel Muir in North Vancouver. Tell us your location, North Vancouver, because it's easy for North Vancouverites or people on the North Shore.
That's right. So I'm at 700 Marine Drive, which is kitty corner from the Oasis Car Wash on Marine and Bewick.
That is an icon in North Vancouver. And your website is snoredoctor.ca.
SnoreDentist.ca.
SnoreDentist.ca. And your license plate is?
SnoreDoctor. SNORDR.
Now, you don't need to knock on the window of your car. You can just go to the website, SnoreDentist.ca. It's been fascinating talking with you. I really appreciate it. And enlightening, I'm sure, for many people. Thank you very much for your time. And once again, SnoreDentist.ca is the website. I'm Zach Spencer. Thanks for listening. Speak to you next time on CL 650.